Good morning. You're watching Lung Cancer Awareness United in Our Goal, an initiative by Lung Connect India Foundation. Now, lung cancer diagnosis often begins with a crucial step, biopsy. Let's talk about the importance of timely testing because a delayed diagnosis can mean the difference between life and death. Joining us now is Dr. Ullas Batra, Co-Director Medical Oncology and Chief of Thoracic Medical Oncology, Rajiv Gandhi Cancer Institute, New Delhi. Thank you so much, Dr. Batra, for joining us. To begin with, could you tell us why is a biopsy done and what are the myths around it?
So, whenever a cancer patient comes to us, I tell them two things. One is what is the disease and one is where is the disease. So where is the disease? We will do a PET scan and MRI. For what is the disease? Is it really cancer or not? Whether it is tuberculosis, it is sarcoidosis, it is pneumonia, we need to do a biopsy. Biopsy is the single most important point in diagnosing a lung cancer patient. I'll just give an example. Let us say a commerce student comes to you and you give them a complex science problem. He will not do good. But if you give the same problem to a science student, he will do well. Similarly, which treatment to give? Whether to give oral medicine, whether to give chemotherapy, whether to give immunotherapy, for that we need biopsy. So the myths associated with biopsy, it's very easy for us to say biopsy. The moment I utter the word biopsy, patient says, Doctor Saab, I will do whatever you want, but I'll not get biopsy done because I have heard that as soon as you get the biopsy done, the cancer just spreads. There can be no more myth than this. No bad vibes then get associated with this. Biopsy is the single most important thing which is there. We need to do biopsy to accurately diagnose the cancer, and cancer does not spread as a result of biopsy.
So once the histopathology report is prepared, what happens next?
So once the histopathology report is there with us, we do some markers called as IHC markers. They will basically tell us which kind of cancer we have, whether we have squamous cell carcinoma, whether we have adenocarcinoma, and then we will send something called the next generation sequencing. Now, we all have heard of, revolutionary medicines called as target therapies, immunotherapies. So by doing NGS techniques, we will find out whether a patient is a candidate for a target therapy or a immunotherapy. And if it is a target therapy, which kind of target therapy you have. In lung cancer nowadays, there are 10 different kind of target therapies which can be given. So A patient may be given an A treatment, a B patient will be given a B treatment. And the best part about them is patient can take these oral medications at home without side effects, without getting exposed to chemotherapy, and the survival and prognosis of these people are much more better. So we should definitely get a biopsy done, NGS done for almost all our lung cancer patients.
Dr. Batra, most people are diagnosed with advanced lung cancer. Why is there a delay in lung cancer diagnosis?
So the delay in lung cancer treatment is because, people do self-medication. People don't want to go to a doctor. And even if they go to a doctor, they don't want to accept that, cancer can happen to them. And to add it, tuberculosis is very endemic. So people, first of all, do not go to a doctor. Even if they go, they take self-medication. Then they take empirical tuberculosis drugs. Then they take MDR tuberculosis drug. And then they get tuberculosis. Then they get biopsy done and then come to us. So my only request to all the patients and physicians around the corner is that do not be afraid of a biopsy. If your patient is not responding to a conventional treatment, please get a CT scan done. Please get a biopsy done and then take it from there.
Dr. Batra, what is the kind of awareness that a patient advocacy and awareness group like Lung Connect India Foundation can create in this regard?
So Lung Connect Foundation has been really godsend for all the physicians and all the patients actually. By the virtue of connecting with the old patients and caregivers and patient advocacy platforms, we need to tell everybody who has a chronic cough, a patient, a caregiver, that biopsy is not bad. Get a biopsy done. You may not even have tuberculosis. You may not even have lung cancer. It could be simple case of sarcoidosis. Do not shy away from get a biopsy done. And even if you have got a lung cancer, that's not a death sentence. There are many treatments available. In fact, if any cancer has shown a tremendous improvement in the last 10 years, that is lung cancer. People are surviving way beyond 4 years, 5 years, even more with use of oral medicines also. So if you have any symptom like cough, bleeding from the mouth, if you have any breathlessness, do not shy away. Go to the doctor, get yourself investigated, and we'll take it from there.
Thank you so much, Dr. Batra. Tomorrow we'll be meeting somebody very critical in the treatment of lung cancer, the caregiver. So do join in. For now, back to the studio for more news on NDTV 24/7.